And like the director,
Hi, everybody. Can I get a roll call, I guess, of who is in the at the ACEH office at this time, and then maybe just chat me when it's updated or when folks come in.
Good afternoon, everyone. I'm not sure if Allison's gonna make it to the meeting today, so she just texted me. So when we are ready, we can call the meeting to order. Right. Welcome. So I'll go ahead and get started. Thank you for the slide. So our mission is to provide dynamic leadership to unite Anchorage in making homelessness rare, brief, and one time. And our values are dignity, respect, equity, and compassion. Is there an agenda for us today? Okay, fabulous. Thank you. All right, so just welcome everyone. And do we have well, let's call this meeting to order. And I'm terrible with this. I'm sure there's rules about this and I always get them wrong, but if we need a motion to call this to order. Is there a motion to call the meeting to order?
Nope, no motion needed. You won't need a motion until the consent agenda, but
Perfect.
Mitch or Emily, do we have quorum?
Let me get a count real quick. Who all is in the office from, how many counselors are in the ACEH office?
I am not there, so someone who's there is gonna have to unmute and give us a quick count. Your picture on my laptop is super tiny.
Roger and Sharon. Oh,
Thank you, Sharon.
Okay, sorry, we were all talking and didn't know we were not audible.
So it's just Roger and Sharon?
Yeah.
Yes,
Okay, thank you. And yes, we have.
Where-
So you said we have quorum?
Yes, we do.
Okay, great. All right, so is Amber going to do a land acknowledgement?
Yes, are we ready?
Yes.
I live and work on the Dena'ina land. I am committed to recognizing and honoring the land, culture, and language of the Dena'ina people. I recognize and respect the continued connection by Alaska Native people and all Indigenous people to the land, waters, and communities. And that is it. Thank you.
Thank you. Yeah, so I was asked to do a mission moment, and so I want to share a story that I was recently told about somebody that is staying in one of our shelters. I probably most of you know we are now a behavioral health center as well. So we've got clinicians on staff. And I think especially with kind of the higher acuity folks that we're seeing, it's been incredibly beneficial. And I think we're really able to help people in a new and more impactful way. So we had a woman who was staying at our shelter, and she, very educated. She had advanced degrees, and she had kind of later onset schizophrenia. And she was writing letters daily to a member of our staff with a lot of information that was pretty clear that she was suffering from psychosis. And I think maybe he got about 150, 250 of these letters over a very short period of time. And we were able to connect this particular person with our clinician, who through some really great work was able to help her get back on meds, which was something that she wanted to do. Really got her to a point where she could tell us, who her family was. We were able to connect our staff with this particular person's family, and the family didn't know that she was staying in the shelter, didn't know that she was there, and really wanted to make sure that they were helping and supporting her as well. And so they've moved her into some housing where she's really receiving a lot of both financial and service support. So it's just really exciting for us, I think, to see really the power of having professionals who can really identify and work with folks that are really having some of these deeper behavioral health issues, and that we can help move them into a place of security and safety. So super happy that we're able to do that. All right, so the consent agenda. Okay, so the meeting agenda changes and approval. Can we see the meeting agenda? Thank you. Are there any changes to the agenda?
I was just looking to try to figure out how to raise my hand, and I can't, so I'll just unmute and talk. The agenda item that was intended to be item number 5, we had some technical difficulties with the applications. So there's going to be a special meeting for the special presentation early next week. But I am substituting a conversation about the collaborative application. So it's still about the NOFO. It's just going to be about the other side of it, the collaborative application and the community input and collaboration that happens there. And then we will go from there with scheduling the special meeting for next week.
Okay, great, thank you. Are there any other changes to the agenda? Or additions? Okay, so can we have a motion to approve the agenda?
I'll make a motion as well.
Second.
Great, thank you. Okay, and then the August meeting minutes. Has everybody had a chance to look over the August meeting minutes? Are there any changes or anything that we need to address from those? All right, hearing none, is there a motion to approve the August meeting minutes?
This is Dave.
I'll make a motion or second.
Okay. So Dave, I heard you motion, and I think Will, did you second?
Yeah.
Okay, great, thank you. All right, so I think we can turn it over to Jessica.
All right, Mitch, are you able to share the PowerPoint? I'm just on my laptop and it's tiny.
Yeah, 1 second.
Okay. So a little bit of background, for those of you who may not know this entire process, every year, Anchorage and all Continuum of Cares, or COCs, are invited to apply for Continuum of Care funds for their community. The majority of those funds are part of our what is called our ARD, or our annual renewal demand, but there's always bonus opportunities as well. So I'm excited that our community had a lot of bonus applications. And so we have bonus projects to put forward when we get to that process next week. But part of ensuring that your bonus projects actually get funded is not just on the strength of the bonus application itself, but the strength of your collaborative application. So what I'm going to talk about today is places where, based on our scores of last year's collaborative application, we had room for improvement, and then what some of our strategies are to address making those improvements to that collaborative application before it is submitted at the end of October to HUD. So next slide, please. So what is the collaborative application? As I said, this process helps inform our collaborative application, and it gives that stakeholders, it gives stakeholders space for input into the total application that goes in with all of our projects. The scores we get from HUD on this application, they impact how much funding we get for our projects. So ACH, the coalition, is the collaborative applicant for Anchorage. And so we submit that application directly to HUD, along with all of the project applications through the eSNAP system. Next slide. So this is, I'm going to very briefly run through our 2023 scoring and a debrief of that. So our application is broken down into different categories, and this is highlighting out of the total application score available of 200 points, where our COC scored, which was 155 points out of 200. And you'll see some yellow highlights on this slide. Those are the places that we're targeting to improve. And so you can see those are the places where we lost the most points. So section 1B, coordination and engagement, inclusive structure and participation. We received the maximum points on that one, which is really exciting. What that section does is it looks at your continuum of care and your advisory council. So our advisory council is our board for our continuum of care. And it looks at the structure of that. And is it inclusive, and does it foster participation? So this meeting is held every month. HUD wants Continuum of Cares to hold at least 2 meetings every month, or every year. We hold one every month. We communicate and advertise this meeting pretty widely. It's posted on social media. It goes out in the coalition newsletter. I think word of mouth really contributes to a lot of our participation as well. So the way that we have structured our continuum of care and our governance is very high scoring with HUD. The next 2 sections, though, 1C and 1D, are the other 2 sections of coordination and engagement. The first section looks at your coordination with federal, state, local, private, and other organizations. I'm sorry, that's what it looks at. It's just broken down into 2 sections. So those organizations might be participating in our COC meetings, or might be participating in our continuum of care, either as providers or as support to our providers. But looking at these scores, what we really need to do as a community is get into the details of that and talk about how that collaboration happens, how that coordination happens, and which organizations are out there involved in our COC. Section 1E looks at the individual projects, looks at the capacity that those projects have, our rank and review process, and how we structured our local competition. Our COC has scored fairly high in this section in the past. Part of that is reflected in those project applications. So if you are someone who submitted an application this year, either for a renewal project or a bonus project, you'll notice there were a lot of questions that focused on equity, particularly around the clients that we are serving and the outcomes that we're presenting, as well as a focus on housing first practices. So HUD really prioritizes and focuses on those areas. And so we wanted to make sure that our local competition had that same focus area. Section 2A is our Homeless Management Information System, or HMIS, and the implementation of that system. That's another place where we score really high. We have pretty good participation in our HMIS. One place that in the past we have had challenges with is something called our bed coverage rate, which is how full our projects are. But we have seen improvements in that over the past year. Section 2B is about our point in time count. Some of those points are just having one. It is a HUD requirement to do that, and we have done that every year. And then the rest of the points are how that process happens. And we have made improvements over the past few years on how that point in time count happens, particularly the count that is for people who are unsheltered in our community. So we have also traditionally scored fairly high in that section as well. Section 2C, or system performance, is an area that focuses on our community's system performance measures. And you can see that out of the total 60 possible points, last year our application scored 37. This is something that I think is really important to talk about. That's why it's highlighted here, because what people don't always realize is that our system performance measures are informed by all of our projects in our continuum of care, not just the projects that are funded by continuum of care funds. So that's why that data quality and that performance is so important for our entire system, not just those COC funded projects. And then last, 3A, is our COC's coordination with housing and healthcare. And this has been a focus area of HUD's over the past few years. Last year, out of the 14 possible points, we only had 2. And one of those reasons why our projects did score so low there is what HUD is looking for is documented coordination and collaboration with healthcare organizations by the individual projects. So not just our COC overall, and do we have healthcare participation and coordination with the housing projects and our continuum of care. They want to look at each of those individual projects and how that they have that documented buy-in and coordination. Next slide, please. So I'm going to talk about those sections that I highlighted for the deeper conversations. So the first one, 1C, the coordination and engagement. So focusing on these key areas and describing and strengthening our collaboration with these key partners. Education, and this is not just the traditional kind of early childhood education, the preschool programs, the Head Starts, the school districts, but also the higher education. And looking at how those educational systems are interacting with our continuum of care, particularly how we are making referrals back and forth. Corrections, so those systems that are working within the Department of Corrections or incarceral system. And again, how those referrals are going back and forth, and how we have coordinated entry built into some of those exits out of those systems. Domestic violence and sexual assault, again, how well or how good is our system at identifying people who are survivors of domestic violence and sexual assault and making those referrals to the appropriate projects. Housing developers, we know that in order to solve homelessness, there has to be enough housing available for everybody to access that is accessible to them and affordable to them. So looking at the relationship between our continuum of care and those housing developers, and how are we ensuring as a COC that we are keeping up with the need. The next bullet is with LGBTQIA+ populations. So again, how are we making those identifications and making those referrals to the appropriate organizations that serve that population? And as a subset of that, how are we ensuring that all of our projects, particularly ones that are funded with our COC funds, are inclusive and equitable to people who are LGBTQIA+. This seems like it's duplicative of housing developers, but looking at our affordable housing providers. So the people who are running and own the housing stock that is affordable and available to our population right now. And how are we coordinating and making those referrals and ensuring that those housing units are available? Collaboration with our public housing authority. So we only have one, and it's AHFC, so that makes our job easier and harder. So we want to document and show how we are having those collaborations with our public housing authority, that we are talking with them about the needs of people experiencing homelessness, that we are identifying where our gap analysis is showing that we have a need for a certain type of housing or a certain type of assistance, and then working closely with our public housing authority to help combine forces and make that available. And then last, but certainly not least, our participating jurisdiction for our HUD funds, which is the municipality of Anchorage. So ensuring that our continuum of care is collaborating with our participating jurisdiction on their HUD funding and their annual action plan to make sure that there's alignment across all of those areas. Next slide, please. Section 2C, system performance measures. So I highlighted the 4 that our community has seen decreases or increases, whichever direction it goes, but negative movement in these system performance measures. In our collaborative application, what HUD is going to ask is for our community, how are we addressing these particular system performance measures? So I look at it as kind of 2 parts. Number 1, what are we doing right now? And then number 2, what is our strategy going forward if we aren't seeing progress? So reductions in the number of people experiencing homelessness for the first time. So what is our community doing right now to reduce those numbers? And what is our strategy going forward? Successful permanent housing placement or retention. So these are our referrals that are going into permanent housing. And then also the retention of people into that permanent housing, which feeds directly into the third one, reducing returns to homelessness. So we really want to look at what our community is doing to ensure that once people are housed, they stay housed and they stay stably housed. And then last, increasing our cash and non-cash income. So after someone is housed, when we do those annual assessments with them, are they seeing increases in their cash and non-cash income? And what is our community's strategy to ensure that when people are permanently housed, they have access to resources to help them do that? Next slide. And then last, coordination with housing and healthcare. So as I said, that applies to our new and our renewal projects, and they're looking for those housing leverage commitments as attachments to our application. The way HUD has called that out is in healthcare formal agreements. So some organizations may already have those in place for their organizations. So we're going to be looking to specify how that particular agreement applies to your specific project. Next slide. So last, our plan, we did this last year as well, and it was really successful, is to host a series of community roundtables. So our first community roundtable is going to be focused on those system performance measures. Actually, these are backwards. I'm sorry. Our second one is going to be focused on those system performance measures, being held October 9th. In a block of time from 10 to noon. This will be a hybrid meeting, and it will be at our coalition offices in person or online via Teams. But we're really going to drill into those system performance measures and brainstorm and talk as a community how we can address that. What are our strategies now, and what are our strategies going forward to make improvements on those system performance measures, particularly those 4 key ones that we called out as important for us to improve. The second roundtable will focus on that coordination and engagement. So at that one, that's going to be where we talk about those key partners and those key focus areas of where we want to see that coordination and collaboration within our COC. That one will be held the afternoon of October 8th from 1 to 3 p.m. And then last, those coordination with housing and healthcare. So those will be set up as individual meetings with grantees, because we recognize not every grantee is in the same place when it comes to that integration and coordination. So we don't want to try to apply a one-size-fits-all solution to all of those individual projects. Next slide. Actually, that might be my last slide. Yep, I think that's where I ended off. So now I just wanted to open it up to get some feedback on this strategy and where people felt like there might be places in our collaborative application, as I talked about our scoring, that we would want to focus on instead of or in addition to these particular areas. And I know we do have a few people on that have been part of this in the past years. And so if you have any advice, or if you have any input into this particular strategy or ideas of things we've done in the past that helped us really strengthen that collaborative application, definitely open to hearing that. This is only my second year with this, and last year when I was doing this process, I had been at the coalition for about 2 months. So I feel like I am open to hearing strategies that other people have used, and I really just want to make sure our community's application is as strong as it can be going in at the end of October.
Laura, I see you have your hand up. Go ahead.
Hey, Jessica, can you tell me where the 2 points came from for the coordination with housing and healthcare?
HUD did not break that down for us, so I can't tell you exactly what it was. But my thought was because last year, the only healthcare MOU that went in was the one related to street outreach. And so I think it was looking at that as a project, or potentially looking at it as a project associate, or as a healthcare integration associated with coordinated entry. But I really can't tell you. HUD gives us very little detail when it comes to some of these sections.
Do we know what our score is this year?
No, this is the score that was from the 2023 NOFO. So I won't know anything else going forward until after we submit it. I could maybe go back to 2022's if we wanted to see what the change between 22 and 23 was.
Okay, no, I was just curious if there was
Yeah.
guidance on it and if it helped us determine or make decisions based on that guidance, so.
Yeah, no, that was one section where they really didn't give us detail. And so all I know is that section 3A is the section that specifically, at least this upcoming year, specifically addresses individual projects in healthcare integration. So.
Okay, do we know if there's been an increase in our system performance measures based off of last year to where we are right now when we pull reports?
We have seen, Mitch, if you want to pop back to that slide, real quick, our length of time homeless has increased, from, prior year. And I think I saw Kim on too. So if I get this wrong, Kim, hop in there too, because I'm not looking at the dashboard right in front of me. Our returns to homelessness, though, if I remember correctly, are either even or slightly down. And then increases to income or changes in cash income and non-cash income was an increase. Let me see if I can pull up the dashboard here really quick.
Yeah, that's what I'm working on as well. Length of time definitely went way up. And I think there's some sort of data quality component that's really going into that. I don't think that it's gone up as much as it appears to have gone up. The returns look roughly stable. There's a little bit of a increase in FY 22, but then it comes back down in 23. Total numbers have gone down year over year for a while. Income increases dropped quite a bit between FY 22 and 23. And one of the things with the income increases is that it only looks at COC funded projects. So it's the one metric that is specific to COC funded projects. And with that, it's hard to get a sense of whether folks are not increasing income or if the data is just not being entered. And that's not something that we've been able to get a good sense of based on the components that we have to check that. So without doing kind of some deep dive audits into specific projects to see whether or not the data is going in and the information or the benefits are just not increasing versus the data is just not going in. And I think there's a little bit of an education component that can go along with that in terms of both collecting updated data, entering updated data, but just the on the ground, like project level activities of working towards increased income for stayers and leavers. But
I know as a provider that the increasing in income piece, a lot of our clients, because they're, you know, on SSI or SSDI, that's fairly set, but
right.
We also count the PFD, and the PFD the year before was extremely high, and then it dropped down significantly, which then dropped down their income, even if they had an increase in their SSI or SSDI. So that might also be playing a factor as well. But I appreciate the information.
No, it definitely does. In fact, just earlier today, I was talking about that and I said, I feel like our PFD is the blessing and the curse when it comes to our system performance measures, because years that it goes up, we see amazing across the board increases in cash and non-cash income. And then the years where it goes down, it usually offsets any other increase that household might have had. We have had that conversation with HUD. So one of the things that we advocated for was changing that to not just be cash and non-cash, but breaking out cash between earned and unearned. And we really advocated for that as a state because that hurts, of course, balance of state as well. So that is an approach that we have.
Different component. There is one component of earned income. There's a different one of non-earned income, and then there's a total line.
Yeah.
So,
so we report it separately, but HUD kind of rolls it all together when they look at it for the purposes of this application. So it wouldn't be that difficult for them to separate it, in my opinion.
New clients is, I don't know, it went up a little bit from last year over this year, and then exits to permanent housing look very wonky for the last 5 years, but don't seem to have been great the last 3 years. So.
Yeah, I think one thing to talk about and think about when it comes to these system performance measures is that if the data is not there, we don't know. So if we don't know where that person exited to, for example, an unknown exit is a negative exit. So the better we can all be at recording actual exits and actual exit destinations, even if it does result in our community acknowledging that we do have a high number of returns to homelessness, at least then we know. So I think the more specific and the more accurate our data can get when it comes to exit destinations, when it comes to recording those annual assessments, and having that documentation of the increase or decrease in cash and non-cash income, I think the better our system performance measures will get, even if we may see in a short-term period negative changes in our system performance measures. Right now, some of the information is just so hard to analyze because it's just missing. We just don't know. We don't have it.
Will, did you want to go ahead? You have your hand up for a while.
Thanks, Mitch. So part of it's been this conversation we just had. I was curious if in last year's, from the application last year, if it was broken down any further for the system performance measures and those 60 points, like where those points came from, where they weren't, is it like 15 points for each measure, or like how is it broken down any further? And if so, like what was the breakdown?
Give me just a second and I'm going to share. I had this handy. So this is the actual document that HUD gave us. So you can see, and I did at one point do like a little bit more in-depth presentation on this. But we can talk. So I can show you where they actually break it down. And so where they broke it down, they call it the high priority application questions. This is the only place where they'll tell us anything. So you can see that these first two sections here, section 1D, both had all of the points they could get. We saw here at the advancing racial equity and homelessness, in terms of how we conduct assessments, how we identify disparities in the provision of our services and our outcomes, implementing those strategies that will improve that. We got 6.5 points out of 7. So we'll definitely do an overview on that section, but I didn't necessarily want to focus very closely on that one. The same with involving individuals with lived experience. We know that we've made some really good progress on conversations around that and ensuring that we have people in decision-making roles there. And it shows we got 4 out of the 5 possible points there last year. So section 1E, this is related to the projects themselves. So even though there is space where we could improve that, those are adjustments that are made at the application level when we put out the application and the scoring for that. It's not part of the collaborative application. And then the HMIS system implementation, this is where I was talking about our bed coverage rate and then submission of our LSA. So our bed coverage rate is that 2.5 out of 4. And then the LSA points is literally just, did you submit a usable file on time? We did, thanks Kim, and we get those points. System performance measures. So here's the detail that they do give us. So we had full points in the reduction of the number of first-time homeless, particularly as it looks at those risk factors. The biggest place for us to improve here is our length of time homeless. And what is our strategy to reduce the length of time that people spend experiencing homelessness? There was a total possible of 13 points there. We only scored 5. So it doesn't tell us which one of these sections was good versus bad. In that response, we had the opportunity to do 3 things. Describe our strategy that is used to reduce the length of time individuals and persons and families remain homeless. Last year, that strategy and that focus was on our coordinated entry system, and that we take that as a factor in our prioritization, how long someone has already been homeless. How our COC identifies and houses individuals and persons and families with the longest length of time homeless. Again, that's part of our prioritization. And then providing the name of the organization that is responsible for overseeing that strategy. So having that key strategy there being nested within coordinated entry, that's how we answered that question last year. But as you can see, we have vast room for improvement there. And so excited to focus on that in that particular roundtable. Exits to permanent housing destinations, we had full points. Returns to homelessness, we got 7 out of the 8. And so that is what is our strategy to identify people who do return to homelessness. So again, those exit destinations are so important. That's how we identify people who return to homelessness. And then what is our strategy to reduce the rate of additional returns? So over the past year, the coalition has stood up that housing retention case conferencing meeting to try to help identify people who might be at risk of returning to homelessness, that have, been housed through our programs, but are at risk of returning, and what strategies or what resources do we have in place that can help prevent that return. Increasing employment and cash income, we had 7 out of 7 points there. And that's the extent of what they broke down for us there. So you can see the scoring categories here in the summary at the bottom include lots of sections that they did not give us that level of detail on, but that is where they did give us that level.
Thanks, Jessica.
Mhm.
And Robin was up next.
Hi, Jessica. I'm just curious a little bit about the healthcare initiative. Can you just tell me a little bit about, you said that they're looking for MOUs that are specific to projects. So, as an example, we have medical respite, we have MOUs with the hospitals. That's what you're looking for?
They're looking for it specifically on the COC funded projects.
Oh, yes, COC.
So yes. And so what we have as a community, that falls into that other section where we talk about the collaboration. And we do have all of those MOUs documented and part of that. This is looking at the specific projects.
Now I gotcha. Okay, thank you. Thanks for that clarification.
And like I said, I think a lot of that exists. I just think we've never looked that closely at it. That was a change, if I remember correctly, that was a change where it was a new question to HUD a few years ago. It's not something we have a lot of history with in our COC. And so this timing is perfect to be focusing on that particular area, and where do we have those integrations and those partnerships already in our COC, and likely in the projects that are funded already. I think it's just a matter of getting that documentation. If you've ever worked in audit work, if it's not written down, it didn't happen. So really trying to get that documentation in place and formalize that relationship and where that collaboration happens. All right. Well, I think my timing might have been perfect there. So watch for some invites that will come out for those meetings. And if you think that you are a person that can contribute to any of those conversations, definitely hop on. If you're not able to attend, but you still want to provide some input or have a conversation, reach out and let us know. Mac and Yvonne are going to be setting up those roundtables that week. I'm on leave that week, but we're happy to get together before or after those meetings to help get your input into it.
Laura, did you have another question or comment?
Yeah, I just had a couple quick questions. One, when should we expect those invites to come out?
I believe they're going out tomorrow, but I will verify.
Okay, perfect. And then can you elaborate a little bit about what the problem was with presenting the rank and review decisions?
Sure. So the if people submitted the submitted their application with the downloaded PDF, it didn't show the full answer. And so we had to go back and get there were 4 applications that were affected by that. So we had to go back and get that information. So it just set rank and review behind by about 5 days.
Okay, all right. Is ACH going to be notifying
Yes.
individuals? Okay, all right.
Yep.
Perfect.
Yep, I'm gonna let everybody who applied know after this meeting, because that's when they would have been expecting to hear, and let them know that it is being rescheduled to early next week, and to watch for something from that. But it does not mean there's anything wrong with the applications at all. The way that the narrative answers were showing, it was cutting off part of some people's answers, and we didn't want to have that negatively affect their application because it wasn't their fault.
All right, perfect. Thank you.
Great, thanks, Jessica. Thank you. So committee reports. Who we got for committee reports today?
Go ahead, Sharon.
Okay, well, my committee report, I submitted the written report, so, but there's one sort of action item. Can y'all hear me? Because I'm on the speaker here. Okay. That I wanted to bring to this body, and it relates to the NOFO and, what metrics we should be using in the NOFO applications to sort of score the applications. Jessica told us that the NOFO applications are now on a 2-year cycle. And this is done deliberately to give COCs the opportunity to spend a whole year developing developing a comprehensive reallocation process. And so that would allow sort of projects that we're submitting to be funded by HUD to align more optimally with community priorities, so on. So, it occurred to me that this, doing that work includes some of the data committee sort of, functions, but also might bring in a variety of other sorts of committees. So I thought that, and because this is a sort of time limited thing, it wouldn't need to be a standing committee, so I'm suggesting that there be an ad hoc committee. And then one of the committee members suggested that this should also include perhaps people who aren't on the advisory council or in committees who are COC recipients. And so I'm not sure of the process for establishing an ad hoc committee, whether that's something that needs to be done by the chair of the advisory council, or it can just be if people step forward and they're interested in doing that. But that's just a proposal I had so that we could work on this over the next year on this process.
I started typing it and then I realized I could just say it out loud. So if you wanted that ad hoc committee to be a standalone ad hoc committee, the advisory council would just vote to create it. If you wanted it to be a subcommittee of the data committee, then you and the data committee would just create it. So I guess it's a little bit of where do you want it to live in terms of its functionality and its oversight.
Okay, well, I think it should be more, at the advisory council level and not a subcommittee. And so I'll make a motion that the advisory council create an ad hoc committee to, I'm not sure what we would call it, a NOFO metrics ad hoc committee.
I'd second that motion. Is Dave.
I will say that I'll volunteer to be on this committee. I wouldn't say that we should create a committee and then not agree to be on.
I'd be willing to be on it too, although I can't believe I'm saying that after getting out of the COC business for a while to kind of come back into it.
And if you create that, because I think you'll need to vote on it, but if you create that ad hoc committee, the coalition can send a general invite out as well, just to the general mailing list for participants, and then target it if there's anybody in particular you want to make sure gets included.
Jessica, since Sharon has already made the motion and it's been seconded, is that something that we can vote on now, or what would the process for that look like?
You can totally vote on it right now. You're in discussion right now, so I just wanted to toss that in for discussion, that if it is voted on and is approved to be created, that's some support we can provide as well to help populate it. You don't necessarily have to populate it right now.
Roger, see your hand up?
Yeah, I just wanted to comment that this is a great idea. I'm totally in support of it. I don't think I personally can commit to time on it. I got some moving parts in my life right now, but I'm totally in support.
Is there more discussion? Well, you got your hand up.
So just for clarification, I'm curious, what is the intended scope of this ad hoc committee? Is it specifically, metrics related to the NOFO review? How much is it related to the systemic or the system performance measures generally, or just wanted to get clarity on what the intended scope is?
Yeah, I think for the chair, if I may, I could answer that. I'm not entirely sure, but I think it's partly my interest in a committee like this sort of sprung out of many years of being on the NOFO rank and review committee and seeing that projects that had received money in the previous year were guaranteed to receive money again the next year. There was really no way that we had on this committee to systematically assess whether the projects were, achieving their goals. So there was really no evaluation component of any sort. But then also there was also no mechanism to see is this what Anchorage really needs? The system as it was set up seemed to make it very difficult for new projects to get into this funding stream. And that, in my mind, that sort of blocked any sort of innovation, at least through this HUD NOFO process. And I don't want to say this is the only source of funding. Of course, it's not. But the problem is, we'd say, well, this is a problem, and then we'd say, well, we should do something about it. And then before we knew it, it would be the next NOFO cycle going around, and there was never anything implemented. But now there's an opportunity to spend the time to work on that, and that's this is why I'm proposing this committee.
Thanks, Sharon. I do have additional thoughts too. Jessica, are you responding to the question too, or want to talk about something separate?
Yes, but it might be the same thing you were about to say. I was going to talk about the HUD priority where they look at your reallocations in a rolling 5 years, and they want to see, to get full points, this is something that's in the collaborative application as well, but it's not something we really have control over. But over a rolling 5 years, they want to see that your COC has reallocated at least 20% of your funds. So getting bonus projects funded, of course, helps with that because it increases the amount that your community has. But yes, that is something that HUD looks at, and not having a formalized COC reallocation policy makes it really challenging to reallocate funds. The only opportunities that exist right now to reallocate funds are either at the rank and review level or when a project gives up their funds. So if a project says, I don't want to apply for renewal, then that opens funds for reallocation. So not having a process could hurt us in the future if we don't have enough providers or enough funds that are naturally reallocated.
Thanks, Jessica. And yeah, I agree with that, as well as what Sharon, what you were saying. You know, I was on the rank and review committee last year and kind of felt somewhat similarly. And you know, we've had some of these discussions within the community prioritization committee as well about kind of the, you know, relates to some of the conversations of the data committee about kind of the need to look at kind of the efficacy of different programs and everything. And then also with respect, you know, I'm looking at the Jessica's presentation today and seeing the, you know, we're leaving a lot of points on the table for the system performance measures. And so, you know, I'd love it to do like a deeper dive and see what we can understand, how much is missing data points, how much of that, you know, can we address through applications, and, you know, talking to funders and having discussions, and then also reallocation policy as well, kind of a bunch of different factors. And yeah, so I support, you know, subcommittee on this. And, you know, I think we should, as far as targeted folks, like try to see if we can get anyone from Alaska Housing, as well as like Jed and anyone else from the Muni involved as well. Could be good folks to try to bring in.
And I will share, because I do see we're getting super close on time, and this was part of my my report, but I'll just say it here because I think it was the most important part, that we do have upcoming some HUD technical assistance that has been assigned to our state that is focused around funding collaboration, particularly between the COCs, the Public Housing Authority, and the participating jurisdiction, along with funders like our philanthropy that exist in our community. So like the timing of all of this, I think, is really good to be having these conversations, because my history with HUD, and I know a lot of you have this same history, that you can tell when they are nudging you directions. And if you don't take the initiative and figure it out yourself, next thing you know, you are voluntold into making those changes. So being the leader and being able to dictate how that change looks for our COC is going to be much nicer than if HUD comes in and says, you must have a reallocation policy and it looks like X. So.
That all makes sense. And I guess I'm ready to call the question if everyone else is.
Does anyone object to the creation of this committee?
No.
All right, I will take that as a unanimous yes and write it down in the minutes. Thank you, everyone.
Thank you, Mitch.
Thank you. All right, Sharon, is there anything else that you wanted to report out on, or are you all set?
No, that's it. Thank you.
Thank you. So we have a couple other committees. Does the prioritization committee have anything to report?
So I didn't get my written report submitted in time. We met a couple, I missed this meeting Monday if they had it, but I think the previous meeting was sort of a discussion on the NOFO builds. And I think there might have been an update on that at the Monday meeting as well.
Okay. Thank you. What about the governance committee? I think Grace is not here today. Is she the chair of that committee? Okay. And then we have the CE committee, the revamp.
I don't have anything to report out, other than we're in the process of identifying a third-party external resource to do an assessment on our current coordinated entry system.
Great. Thanks, Laura. I think that's it for committees. Can you just pull up the agenda real quick? I think now we're pretty much just into sort of some advocacy and then adjournment. Is there anything that anybody wants to report out, or any kind of advocacy opportunities that anybody wants to share?
We did have a report from ICA. I don't know if
Oh, sorry. Yep.
yeah, that's okay. If anybody's in the I think I may have seen Kim in the conference room there, but if there's anything to add or any questions that went out with the agenda, and that should be quarterly or perhaps monthly going forward.
I am here. I don't have anything to add to it, but happy to answer any questions. Great.
Okay, thank you. And then, okay. So we're soliciting member and public comment. Sharon?
Yes, thank you. I just wanted to encourage members of the advisory council to sign up for Project Homeless Connect. I didn't even know it was happening in a couple weeks. I got an email today, said please sign up and volunteer. So I did. Several of my UAA colleagues have done so as well. I've worked on it before, but it was always when it was super cold, and I'm hoping that having it in October will make it, I don't know, maybe better to be outside. It's a different location too, so I'm really excited about it. Thank you.
Thank you.
You, Sharon. It's sort of breaking news, because we didn't have a date set until we had a better idea of the date they were planning on turning on cold weather shelter. So we wanted to structure it around that. But now there's a date, and it's October 15th. And I hope everybody who wants to participate can participate. If you're a provider, you'll probably be getting an email, if you haven't already, about do you want like a table? Do you want to be a provider at Project Homeless Connect? And of course, it's open to anyone to just come and volunteer. But we'll have provider space available. We'll have medical services. We'll have winter gear that we're handing out, coats, snow pants, hats, gloves, boots, wool socks, headlamps, reflective tape, lots of visibility gear, along with hygiene items and food and lunch.
Thanks, Jessica. Is there anybody else? Okay, so any good news and celebrations? Anything anybody wants to share?
Amber, I saw your hand go up. Did you have a?
No, I just had a question. You said the Anchorage Project Homeless Connect was on the 15th of October?
Sorry, yes, October 15th, from 11 a.m. to 4 p.m.
Okay, thank you.
Mhm.
Okay. So here's the list of advocacy opportunities, and these are posted on the website, correct, Jessica?
Didn't see.
These are not posted as such. These are gathered from the ACEH events website and the municipal assembly calendar. And I did want to mention today, you know, any of the providers out there, we could definitely set up a channel for adding some more variety to this, because I know there's a lot going on. But this is kind of, you know, just one of those, how we've been doing it, and these are great events, but it'd be great to have some more variety on here. So info@hprsadvisorycouncil.org if you have if you want to connect your organization's events to these meetings, we would love to have them.
Great, thank you. Okay, I was just reading Dave Kuiper's chat that emergency cold weather shelter will begin on October 1st. All right. Okay, well, it looks like we're coming to a closer. I know we're over time. Can I have a motion to adjourn the meeting?
I vote to adjourn, Sharon.
Is there a second?
I'll second.
Roger.
Thanks, Roger. All right, great. Well, thanks, everybody. Yeah, stay safe, and hopefully we'll see a lot of people at Project Homeless Connect.
Thank
Thanks,
you.
everyone. Have a good night.
Good night.
All right, around, I got kids to grab.
Yeah, see you later, Kim.
So if I can get the time off, how do I volunteer?
So I was thinking about, while you were here, we have, are you